The sterile operating room. 7-year-old Jason on the table, chest open, heart exposed. Dr. Cross's hands trembling, blood pooling. He nicks the pulmonary artery. A catastrophic error. Alarm shriek. Cross panics, then rage pivots. "Bennett, what did you do?" Nurse Pamela tries to speak. "Doctor, the arterial." Cross grabs surgical scissors and hurls them at her head. They whistle past her ear, embedding the wall. The entire freezes in horror. Pamela doesn't flinch. Her eyes go cold, calculating. She moves. Welcome to Mr. Bryan's Tale, where every story takes you on an unforgettable journey. Whether it's thrilling adventures, heartwarming moments, or tales that'll keep you on the edge of your seat, this is your destination for captivating storytelling. If you love getting lost in exciting narratives and discovering new worlds with every video, you're in the right place. Don't forget to hit that like button and subscribe so you never miss out on the next amazing tale. Trust me, you won't want to miss what's coming next. Metropolitan General Hospital bustled with controlled chaos of a level 1 trauma center, but Nurse Pamela Mercy moved through it like smoke, present but unnoticed. She was 29 but looked younger, with dark hair always pulled back, large eyes that seemed perpetually tired, and a voice so soft that doctors often asked her to repeat herself. "Bennett, restock Bay 3. Bark charge Nurse Rodriguez." Pamela nodded without meeting her eyes. She'd been at Metro General for 6 months, taking every graveyard shift, every holiday, every assignment no one else wanted. The other nurses assumed she was either desperate for money or lacked the confidence to advocate for herself. They were wrong on both counts. Pamela adjusted her long-sleeved undershirt beneath her scrubs. Even in the summer heat, she never rolled up her sleeves. The fabric of the small tattoo on her inner left wrist, a stylized eagle and shield, the emblem of the FBI hostage rescue team. HRT, the most elite tactical unit in federal law enforcement. Former HRT, former paramedic, former crisis negotiator, former a lot of things. She restocked the supplies with practice efficiency, her movements economical and precise, muscle memory from years of tactical operations. Every motion conserved energy, minimized noise, maximized effectiveness. But here, in the fluorescent glare of the ER, those skills were buried deep. In the medication room, she dry swallowed her daily beta blocker. The pills kept her heart rate steady, dampened the hypervigilance that made civilian life feel like walking through a minefield. Her therapist called it transitional medication. Pamela called it the only reason I'm not scanning every room for snipers. Dr. Maximilian Cross strode into the ER like a man who owned it, because in every way that mattered he did. At 48, he was Metropolitan General star pediatric cardiac surgeon, the man who operated on senators' grandchildren and signed autographs at medical conferences. He was also a nightmare. "Where's my pre-op on the Jennings case?" Cross's voice boomed across the nurse's station. His salt and pepper hair was perfectly styled, his white coat immaculate, but his eyes were wrong. Pupils dilated, gaze unfocused despite the aggressive posture. Nurse Maya Chun, a veteran ICU nurse with 15 years' experience, fumbled with a tablet. "Dr. Cross, the labs are still processing." "Incompetent." He snatched the tablet from her hands. "Do I have to do everyone's job around here?" Maya's hands shook as she stepped back. Pamela watched from the supply closet, her jaw tight. This was Cross's pattern. Brilliance tainted by cruelty, surgical skill corroded by something else. Substance abuse, Pamela suspected. She'd seen it before in high-performing federal agents. Functioning addicts who performed miracles 90% of the time, then catastrophically crashed. Cross stormed toward the surgical wing, leaving a wake of tense silence. "He's getting worse," Maya whispered to Pamela later, during a rare quiet moment. "Last month, he threw a chart at Dr. Peterson. 3 weeks ago, he made Nurse Davis cry so hard she quit mid-shift. Admin won't touch him because he brings in millions." Pamela said nothing. She'd learned silence was survival. Speaking up meant exposure, questions, attention. And attention meant someone might dig into her past. The ambulance bay doors crashed open at 2:47 a.m. Paramedics burst in, wheeling a small gurney surrounded by organized chaos. 7-year-old male named Jason Porter, congenital heart defect, sudden decompensation, BP dropping, needs immediate surgical intervention. Pamela's training kicked in before conscious thought. She was at the gurney instantly, assessing the child with trained eyes. Jason was pale, lips blue, small chest heaving with the effort to breathe. His mother ran alongside, sobbing, clutching a stuffed bear. Tetralogy of Fallet, Pamela murmured, recognizing the constellation of symptoms. He needs me. Dr. Cross appeared, shoving past residents. He'd been on call but clearly hadn't been sleeping. His breath carried the faint ghost of alcohol beneath mouthwash. His hands trembled slightly as he grabbed the chart. Pamela's internal alarm screamed. Every instinct she'd honed in the FBI told her Cross was impaired. But she was just a nurse, a nobody, a ghost. Prep or 3, Cross ordered. Move, people. This child needs emergency repair now. The team mobilized. Jason was rushed towards surgery, his mother's cries fading behind secured doors. Pamela found herself assigned to the surgical team. Standard protocol for complex pediatric cases requiring extra hands. In the scrub room, she watched Cross prepare. His movements were off, too fast and too slow. He dropped the scrub brush, cursed, grabbed another. Pamela closed her eyes. Breathe. In for 4. Hold for 4. Out for 4. She was about to break her 6-month silence. Or a child was going to die. The surgery began at 3:15 a.m. Jason's small body looked impossibly fragile under the brutal lights, his chest cavity exposed, his malformed heart visible. For defects that would kill him without correction. Cross's hands shook as he worked. Sweat beaded on his forehead despite the room's chill. Suction. Clamp. Retractor. Faster, Bennett. Pamela handed him instruments with mechanical precision, but her mind was in threat assessment mode. His pupils were blown. His fine motor control was deteriorating. He was making micro-corrections that suggested impaired depth perception. Then it happened. Cross's scalpel slipped. Just 2 millimeters. But in pediatric cardiac surgery, 2 millimeters was the Grand Canyon. The blade nicked the pulmonary artery. Blood fountained. Damn it! Cross jerked back. The monitors erupted in alarms. Jason's pressure plummeted. Bennett, you bumped my arm. What are you doing? Doctor, I didn't. You incompetent. Cross grabbed a pair of surgical scissors from the tray. Time slowed. Pamela saw his arm cocked back. Saw the rage in his eyes, the cornered desperation of an addict whose mask was slipping. He threw them. The scissors spun through the air, a blur of steel. They missed Pamela's temple by 2 inches, embedding in the wall with a thunk that silenced the room. The pediatric resident gasped. The anesthesiologist stood frozen. Maya's eyes went wide with horror. But Pamela Mercy didn't move, didn't blink, because 6 months ago, a terrorist had pointed an AR-15 at her face from 3 feet away. Scissors were nothing. The operating room held its breath. Jason was dying on the table, blood pressure crashing, his small heart struggling against the hemorrhage Cross had caused. Every second meant irreversible brain damage. Pamela looked at the child, then at Cross, who stood frozen, scissors still in throwing position, face pale with the realization of what he'd just done. She made a choice. Dr. Cross. Her voice cut through the chaos, not loud, but commanding. The voice she'd use to negotiate with armed suspects. Stepped back from the table. Cross blinked. What did you... Jason is bleeding from the pulmonary artery nick at the anastomosis site. Pamela's voice was clinical, steady, utterly calm. You're impaired. I'm taking control of the situation. Step back. You don't give me orders. Pamela moved around the table with fluid grace, positioning herself between Cross and the patient. Her eyes met the pediatric residents. Dr. Kim, your first assist now. I need 4 to 0 proline suture and vascular clamps. Maya, increase blood product delivery. Anesthesia, push vasopressors. He's compensating, but we have maybe 90 seconds. The team stared at her. This wasn't the quiet, invisible nurse. This was someone else entirely. Now, Pamela commanded. The team moved. Dr. Kim, shaking, stepped up as Pamela guided her hands. Small bites interrupted sutures. You know this. Breathe and trust your training. Pamela's hands moved with practiced precision, anticipating every need. This wasn't nursing. This was tactical medicine, the kind performed in helicopters and under enemy fire. Jason's pressure stabilized. The hemorrhage stopped. The monitors quieted. The surgery ended at 5:47 a.m. Jason was alive, stable, wheeled to pediatric ICU with his mother crying tears of relief. The OR team stood in shocked silence. Dr. Cross ripped off his surgical mask. His face was a mask of fury and humiliation. You just assaulted a surgeon and hijacked my operation. You're done, Bennett. Pamela stripped off her gloves, her expression neutral. I saved a child's life after you threw weapons in a sterile environment and caused arterial bleeding through impaired technique. Lies! Cross stepped toward her, aggressive. I will have your license. I will yendi you. Before Pamela could respond, the doors burst open. Dr. Richard Vaughn, Chief of Staff, entered with 2 security guards. He looked between Cross and Pamela, already calculating. Dr. Cross, take a moment in your office. We'll handle this. Vaughn's tone was soothing, placating. He turned to Pamela. Nurse Bennett, you're suspended pending investigation. Badge and access card. Now! Sir, Dr. Cross was visibly impaired and through surgical. I said now. Vaughn's voice hardened. Security will escort you out. The guards moved forward. Pamela stood her ground for 3 seconds, long enough to make eye contact with Maya and Dr. Kim, long enough for them to see she wasn't afraid. Then she handed over her badge. As security walked her through the hospital corridors, staff stared. Whispers followed. By the time she reached the parking lot, the story was already being rewritten. Unstable nurse attacks respected surgeon, endangers child's life. The cover-up had begun. Pamela sat in her studio apartment, still wearing her scrubs, staring at her phone. She had 3 missed calls from Metropolitan General HR and 1 email. Termination proceedings initiated. Do not contact staff or return premises. She should let it go. Walk away. Find another hospital, another city, another life where she could disappear again. But Jason's small face kept appearing in her mind. And behind him, others. How many children had Cross operated on while impaired? How many mistakes had been buried? Her phone buzzed. Unknown number. Bennett? It's Maya Chan. The ICU nurse's voice was hushed, urgent. Don't hang up. I believe you. And you need to know something. Pamela's pulse quickened. I'm listening. You're not the first. 3 nurses in the past 2 years reported Cross for erratic behavior. All were fired or forced to resign. They signed NDAs. But I kept copies. Maya paused. There's more. Cross has a pattern. Surgical complications that shouldn't happen. Kids who should have been routine successes but ended up with extended ICU stays, infections, medication errors. All swept under the rug. Why are you telling me this? Because you stood up to him. And because... Maya's voice cracked. My niece had surgery with Cross 8 months ago. She didn't make it. They said it was her condition. But I saw the file. The errors. I've been too scared to speak up. Pamela closed her eyes. Here it was. The choice she'd been avoiding for 6 months. Where are these files? Pamela stood on the balcony of her apartment at 3 a.m., phone in hand, staring at a contact she hadn't called in 6 months. Marcus Reed, FBI. Marcus had been her partner in HRT for 4 years. He'd been there the night of the compound raid. He'd pulled her from the rubble after the explosion, held her while she screamed, testified at her clearance hearing that she'd done everything right. He'd also been at her resignation ceremony, and he hadn't tried to stop her. She pressed call. 3 rings. Then a familiar, gravelly voice, alert despite the hour. Mercy? Is that you? Hey, Marcus. Silence. Then, you okay? Are you in danger? Always a protector. I'm fine, but I need help. Not for me, For kids. Lots of them. She told him everything. Cross's impairment, the thrown instruments, the surgical error, the pattern of complications, the NDAs, the institutional cover-up. Marcus listened without interrupting. Another thing she'd missed about working with him. When she finished, he was quiet for a long moment. Mercy, I need to tell you something. We've had Metropolitan General Hospital on our radar for 3 months. Financial Crimes is investigating a pharmaceutical kickback scheme. Doctors taking bribes to prescribe specific medications. We haven't been able to identify the primary targets, but your Dr. Cross just became very interesting. Pamela's mind raced. If he's prescribing unnecessary medications to children for money, then those complications aren't accidents. They're criminal negligence, maybe manslaughter. Marcus's voice hardened. I need you to come in. Officially. Marcus, I can't. I know, but those kids need you. The medical board hearing room was packed. Families across his former patients filled every seat. Their faces a mosaic of grief and rage. News cameras lined the walls, full transparency, demanded by the victims' advocates. Dr. Maximilian Cross sat at the defense table in an expensive suit, his attorney whispering urgently. He looked diminished without his white coat, without his operating room kingdom. Pamela sat in the witness section, flanked by Special Agent Marcus Reed and Maya Chun. Her hands were steady. She'd spent the past 2 weeks helping the FBI build an airtight case. Financial records showing $400,000 in pharmaceutical kickbacks, falsified credentials from a medical school in the Caribbean that had closed for fraud, toxicology reports proving Cross operated while impaired, testimony from 47 families whose children suffered under his care, and surveillance footage from the OR. The board chair called the room to order. Dr. Cross, you stand accused of criminal negligence, fraud, practicing medicine while impaired, and receiving illegal compensation to endanger patients. How do you respond? Cross's attorney stood. My client. Play the video. The chair interrupted. On the massive screen, the footage rolled. Jason's surgery. Cross's shaking hands. The arterial nick. And then, in horrifying clarity, Cross hurling surgical scissors at Nurse Pamela Mercy. Gasps filled the room. A mother screamed. Cross's face went white. The FBI presented evidence. The pharmaceutical company executives who paid him, the falsified credentials, the children who died. When the gavel fell, Cross's medical license was permanently revoked. Criminal charges pending. Pamela exhaled. It was over. 3 weeks after the hearing, Pamela stood in Metropolitan General's newly renovated conference room. The hospital had undergone seismic changes. Dr. Vaughn resigned. The board was restructured, and a patient safety and advocacy department was created. They'd offered Pamela the director position. Marcus Reed leaned against the doorframe, arms crossed, watching her contemplate the offer letter. You know, HRT would take you back in a heartbeat. We have an opening in critical incident response. Your skills, your experience. I know. Pamela turned to face him, and for the first time in 6 months, she smiled, genuine, unguarded. But I think my mission is here. She walked to the window overlooking the pediatric wing. Small faces pressed against glass, children recovering, playing, living. Jason Porter waved from his room, his mother beside him, both grinning. I spent years running toward danger with a gun, Pamela said softly. Maybe it's time I run toward it with healing hands instead. Marcus nodded, respect clear in his eyes. You always were the bravest one on the team. That afternoon, Pamela pinned on her new badge. Pamela Mercy, RN Director, Patient Advocacy. She didn't wear long sleeves anymore. The FBI tattoo on her wrist was visible, a reminder of who she was, all of who she was. In her first staff meeting, she addressed 40 nervous nurses. Silence protects the guilty. Your voice can save lives. And I promise you, in this hospital, whistleblowers will be protected, not punished. The applause was thunderous. Pamela had finally come home. Pamela didn't just save Jason's life that night in the operating room. She saved dozens of future children by refusing to stay silent. She proved that your past doesn't define you. It prepares you. Her FBI training didn't disappear when she became a nurse. It made her a better nurse, a fiercer advocate, a guardian for those who couldn't protect themselves. Sometimes the quietest people in the room are quiet because they're carrying the weight of everything they've survived. And when they finally speak, the world stops to listen. Here's a lesson we can all take from Pamela's story. Don't let fear silence you when you witness injustice. Don't let intimidation make you complicit. Whether it's at work, in your community, or in your own life, your voice matters. Speaking up might feel impossible, but staying silent when lives are at stake, that's the real danger. So here's my question for you. If you were in Pamela's position, watching someone in power hurt innocent people, would you have the courage to stand up? Or would you stay quiet to protect yourself? Drop your answer in the comments below. I want to hear your thoughts. And if this story moved you, inspired you, or made you think differently about the power of one person's courage, do me a favor. Thumbs up, smash that like button. It tells YouTube to share this story with people who need to hear it. Bell subscribe to Mr. Brian's Tale and hit the notification bell so you never miss another story of ordinary people doing extraordinary things when the pressure is on. Speech balloon comment below with the name of someone you know who has the courage to speak up when others stay silent. Let's celebrate real-life heroes. Mobile phones share this video with someone who needs to hear that their voice matters, that standing up for what's right is always worth it, even when it's hard. Every story I share on Mr. Brian's Tale is about real human courage, real struggles, and extraordinary things that happen when ordinary people refuse to back down. If you're here for stories that make you think, feel, and believe in the power of doing what's right, you're in the right place.